Hi, thanks for having me. I'll jump in and get started. So tonight we're going to be talking about non-surgical management of injuries in sporting dogs. And kind of our goals for this talk are to describe the various non-surgical treatment options of soft tissue injuries and what those mechanisms of action are, to review the current evidence regarding each of the treatment modalities, and then kind of discuss how those modalities can be integrated into treatment plans for specific soft tissue injuries. So kind of a brief agenda. We'll talk a little bit, have a little bit of an introduction, and then these are the modalities we're going to be talking about. We're also going to talk a little bit about therapeutic exercise basics, and then protocols for specific conditions. So the caveats for this, I feel like this is a caveat for all of my talks, is that there's very little research on sporting dogs. So we really don't have any prospective research. Most of the research we have is retrospective. And then separate from sporting dogs, there's very little research on various treatment modalities, particularly for soft tissue injuries in dogs. We have lots of research on surgeries and cruciate and all of those types of things. But when we're actually talking about the soft tissue injuries, the research is much more sparse, and especially when we're talking about modalities for those treatments. So the injuries for dog sports tend to be sport specific. So the injuries for agility dogs are a little bit different of a pattern than injuries for flyball dogs. And really, those are the two sports that we have the most research in. If we're looking at injuries in, competition obedience dogs or protection sports or dock diving or fast cat, we don't have anything. But we can assume that those sports would have their kind of specific injury patterns as well. And anecdotally, we kind of know what those injury patterns are. We just don't have publications to support it. So the most common injuries in sporting dogs tend to be soft tissue injuries. And those injuries are particularly found in the shoulder, the carpus, the iliopsoas, and the stifle. And the kind of order of those injuries depends a little bit on the sport. So shoulder is most common in agility and flyball. Carpus, surprisingly, isn't as common in flyball as people expect. Iliopsoas is common in agility and flyball, and then stifle is kind of usually the third, fourth or so kind of injury in all of the dog sports. So it's less common, I think, than people expect it to be. So one of the big, factors in treating soft tissue injuries, regardless of whether they're a sporting dog or not, but particularly for our sporting dog clients who have, goals for performance and competition, is that we really have to understand the timeline for tissue healing. We know that bone can reach 100% strength by 12 weeks, but soft tissues take a lot longer to heal, and they may not ever reach full strength. We know that tendon, ligament, and fascial tissues are generally less vascular, and so healing is expected to take up to a year to approach full strength. And the speed and degree of healing will depend on the vascularity of the tissue and the degree of injury. So this is a nice table that kind of gives you an idea of the time frame for healing. And so you can see that, bone has a very consistent time frame for healing. That's that purple section. But for muscle, tendon, and ligament, you've got this huge range. So it can be really kind of short if you've got a grade 1 muscle injury or ligament injury or kind of an acute tendon injury. And then this kind of progresses to 5 to 7 weeks, 2 to 3 months, 3 to 6 months. And if you look at the ligament and tendon injuries, 6 to 12 months to even over a year. Muscle being a little bit shorter than kind of the tendon and ligament injuries. But that's a significant period of time. And so we have to really expect at least 2 to 4 months of rehabilitation therapy, followed by at least 2 to 3 months of conditioning and sport retraining. That's a fairly common timeline for treatment of soft tissue injuries in sporting dogs. So the client that says, oh, my dog, has this big competition in 4 weeks and they have a tendon or ligament injury, the chance that that's going to be healed in that time frame is very low. So, setting the clients up and setting their expectations is really key for managing these soft tissue injuries, regardless of what they are. And so our goals for non-surgical management are to potentially speed that healing process. We also want to improve the tissue healing. We know that soft tissues, because they sometimes don't ever heal normally, we want to reduce the amount of fibrous tissue formation, because especially for these sporting dogs who are likely continuing to have repetitive stresses because of the demands of their sport, they are at a higher risk of re-injuring tissue that either hasn't completely healed or has healed poorly. And so anything that we can do to manipulate that healing time frame, to manipulate how that tissue heals, potentially benefits that dog for return to sport. So like I mentioned already, setting client expectations is key. And so this involves providing detailed instructions and a detailed timeline. But on the flip side of that, so, sometimes that's a real bummer, telling people that their dog can't compete for 6 months is, a big hit for a lot of these clients, especially if they have big goals for, world team trials or national competitions. But at the same time, these clients are typically very dedicated. And so we can use that dedication to kind of work for you and work for your dog or work for their dog. And so taking advantage of home exercise plans, so therapeutic exercises, and using home-based modalities, these owners will definitely be on board for that. Sometimes two on board, so you have to kind of manage those expectations as well. But, definitely taking advantage of the dedication and their willingness to, get their dog back as quickly as they can. So we're going to talk a little bit about treatment modalities because I do use a lot of modalities for treatment of soft tissue injuries. And I typically use them more aggressively in the sporting dogs than I do maybe in a pet dog that the owners, don't have as high of goals. So I typically am a little bit more aggressive with my treatment, the higher their, kind of goals are. And so treatment modalities that we're going to talk about are extracorporeal shockwave therapy, photobiomodulation therapy, orthobiologics, pulse electromagnetic field therapy, and manual therapy. These are going to be kind of brief overviews because any one of these modalities could be its own lecture. So it's going to be kind of very, top of the line, like what we know, what the mechanism of action is, especially with orthobiologics. That's a whole multiple lecture series, but we're going to touch on it briefly. So extracorporeal shockwave therapy, I would say this is my first line choice a lot of times for soft tissue injury treatment, especially in the sporting dogs, but also in just the general pet population. So for those of you who aren't familiar with the technology, extracorporeal shockwave therapy uses focused high velocity sound waves. So it's a high amplitude pressure with kind of a short buildup time and this exponential decay followed by a negative pressure. And it's important to note that even though it's a sound wave, shock waves differ from ultrasound waves. So therapeutic ultrasound, the goal is to heat up tissue. So it has a thermal effect. Shock waves are lower frequency and they have minimal tissue absorption. So they don't have that thermal effect that therapeutic ultrasound has. There are three types of focused shockwave units. So there's the electrohydraulic, the piezoelectric, and the electromagnetic unit. You'll also probably, if you read the literature about shockwave, there's also a radial shockwave that's been used in some studies, but it's not focused. So it's not really considered a true shockwave. It's more of a pneumatic mechanical concussion. And the important thing to note about the three types of focused shockwave units is that they're all different. And so you can see kind of on the photo or on the diagram on the right side of the screen that the focal area, pressure, and wave type differ. So The electrohydraulic has a bigger focal area, more pressure, and kind of a deeper wave. And so the really kind of important thing to note for this is that because they all have different energies and properties, the protocols are not equivalent or comparable. So if you're reading a study that uses an electrohydraulic protocol, you can't take that protocol and put it right into your piezoelectric unit, and this vice versa. So knowing your specific unit, what the settings are, what the energy is, what the absorption, what the depth of penetration is important in tailoring your unit for the therapy for their dog. So what's the mechanism of action of shockwave therapy? It's got a lot. So it exerts direct and indirect mechanical forces on the bone, soft tissue, and muscle, particularly where you have a tissue interface. So change from tendon to bone, tendon to muscle. It has protection for chondrocytes. It disintegrates calcifications, and then it recruits stem cells to the treatment site. There was a really nice recent human review on the therapeutic effects of shockwave. And so this kind of gives you a rundown of what evidence they have on the human side for biologic effects of therapy or of shockwave therapy. So you've got analgesic effects, so the different ways that it affects analgesia, tissue repair effect. And this is really the kind of area, that tissue repair effect, that we're looking at using for treatment of soft tissue injuries. We know it has an osteogenic effect. That's one of the first things it was used for, was actually to help with bone healing. But if we're talking about soft tissue injuries, especially for our sporting dogs, we want that tissue repair. So we want proliferation of our tenocytes. So if we're treating tendon injuries, we want to eliminate those damaged matrix constituents. We want to enhance collagen synthesis. If we're talking about trying to improve the healing of tendons and ligaments and reduce the risk of developing fibrous scar tissue, we want good collagen organization. So enhancing collagen synthesis is critical. And so these are, all really important factors when using it for soft tissue injury treatment. And so what evidence do we have on the canine side? Not a lot, nothing prospective at this point has been published. But we have some evidence from retrospective studies on using it for soft tissue, especially tendon and ligament injuries. So this study was a recent one using shockwave therapy in supraspinatus and bicep tendinopathies. They had 30 dogs. Some of them had, or most of them had, bicep and supraspinatus tendinopathies together, and then most dogs had it bilaterally. They found that there was an improvement in ultrasound score and lameness evaluation. So that's good. But retrospective, not controlled. This one was a piezoelectric unit, not an electrohydraulic unit. Then there was this study by Lehman that looked at shockwave therapy and therapeutic exercise, also for supraspinatus and bicep tendinopathies. This one used an electrohydraulic unit. It also was retrospective. For about half of the dogs had both bicep and supraspinatus, about half had just bicep, and a smaller number had bilateral than the previous study. They combined shockwave and then therapeutic exercises, plus or minus some rehab modalities as well. This was just based on owner assessment, so did not look at ultrasound, did not look at, objective lameness, but 85% of dogs had a good to excellent outcome. So while it's not 100%, it's, still overall a pretty good response to treatment. This one is a human study. And so, we are very limited in our canine studies. And so we often look at kind of the human literature for what's the evidence, especially for things that have a similar pathophysiology as it would in canines. So tendon and ligament injuries, even though the joints, shoulder joint is clearly different in humans than it is in dogs. Knowing what the effect is on the human shoulder may give us a little bit of idea how it would affect the tissues in the canine shoulder. And so this looked at supraspinatus calcific tendinopathy. So for those of you who diagnose supraspinatus tendinopathies in dogs, often there's mineralization in that supraspinatus. They are often calcific. And they found that both groups had significant decrease in pain and improvement in function because they did shockwave and then shockwave plus exercises. So once again, that's good. We can use shockwave alone. We are often pairing it with therapeutic exercises in our canine patients, especially for our sporting dogs. So, some evidence that seems to be a moderate level of evidence, and this one was prospective. So, a little bit higher quality evidence on the human side than the canine side at this point. The general treatment protocols, this was from kind of a review article and this, once again, remember that the protocols are not comparable or exchangeable between units. This is for the electrohydraulic pulse vet unit. For shoulder tendinopathies, depending on the size of the dog, this one says a 20 millimeter trode. Sometimes on smaller dogs or especially really thin dogs, I would use like a less depth trode, so a 5 millimeter trode. A lot of our sporting dogs are kind of thinner dogs, especially like thin border collies, that supraspinatus and bicep tendon are pretty superficial. I also see supraspinatus tendinopathies a lot in the really fat labs, which, not really sporting dogs, but those dogs I will often use a 20 millimeter because you're trying to get through more tissue to get to that bicep and supraspinatus. So photobiomodulation therapy, also known as laser therapy, and it's the use of red or near infrared light to stimulate healing, provide analgesia, and reduce inflammation. It has a whole, slew of mechanisms of action based on those photons being absorbed by the chromophores. And so it causes all of these cell signaling cascades, effects on cyclic AMP, nitric oxide, calcium, activates transcription factors, affects gene expression. And so we know it has all of these different kind of changes with photobiomodulation therapy. And what we're looking at specifically for these soft tissue injuries is the same thing like we were talking about with the shockwave, is stimulating mesenchymal cell proliferation, stimulating synthesis of collagen type 1 and 2, improving that collagen organization. We want that fiber pattern to return to as normal as possible if we can help get that healing a little bit better. And then decreasing pro-inflammatory cytokines. So what do we know? Basically nothing, unfortunately, in dogs. And we don't have any studies on laser therapy in tendinopathies or ligament injuries. We have studies on osteoarthritis and neurologic conditions and things like that, but not specifically on tendon or ligament injuries. There are, however, human and rat studies. So if we're assuming that the, tendon and ligaments, they're structurally similar between dogs and people and rats, that there are likely the similar effects. The other issue with the studies that do exist on laser is that there are no standardized treatment protocols. So the study protocols vary widely, which makes it really hard for us to determine what's the best, treatment protocol for our veterinary patients. And it's really honestly a guessing game, unfortunately, until we have more research. So here are some of the studies that exist kind of on the human and rat side, but these are all looking at these biologic effects on tendon and ligament healing, so that, improve collagen organization, which like I'm going to kind of repetitively talk about because really, and we don't really have the evidence to say, oh, well, if we make the tendon, the collagen organization better and reduce fibrous scar tissue, that will reduce the risk of injury in these sporting dogs. We can't say that 100% based on the lack of, studies in the sporting dogs, but it's, I think, fair to assume, and at least, based on anecdotal, evidence and kind of experience, the dogs who have more normal, tendons and ligaments on ultrasound after treatment tend to have less recurrence of injuries. So, this is made up, but my protocol for tendinopathies and ligament desmitis is about 20 joules per centimeter squared. And then I usually try to start them out at 2 to 3 times a week. At least anecdotally, that seems to work well. I don't have any actual studies to back that up. So, take that with a grain of salt. Orthobiologics. So this could be its whole separate set of talks. There are kind of multiple orthobiologics depending on whether they are blood derived or stem cell derived. And then there are all different ways of processing to get different products. And so your kind of big categories are autologous conditioned serum, platelet-rich plasma, and then you've got different kind of categories within that. So whether there is a high number of white blood cells, a low number of white blood cells, then you've got autologous conditioned plasma, which fits under there too. They all sound the same. So, that's also confusing because you're like, oh, this is conditioned serum plasma solution. But it just basically is dependent on how it's processed and what kind of product you get. And then you kind of have your stem cell category. And so you can have adipose-derived stem cells, and then you can have bone marrow aspirate derived stem cells. And then it's kind of broken down from not just where they come from, but then how they're processed. So you can have, culture expanded adipose-derived stem cells, and then cultured bone marrow-derived stem cells. And so it all gives you kind of different products. Unfortunately, I feel like I'm a broken record about this. There's really no evidence one way or the other which works better than another. For soft tissue injuries specifically in our canine patients. We don't know whether stem cells are better than PRP or vice versa, which type of stem cell or what type of PRP product is better than another, which is a little unfortunate. So, we're flying blind a little bit for some of the regenerative medicine things, but we have some kind of retrospective studies looking at least overall effect clinically. So platelet-rich plasma is what I use most often for treatment of soft tissue injuries, especially in the sporting dogs. It induces a transient inflammatory effect that triggers tissue regeneration. So it stimulates cell recruitment and proliferation. The platelets and their growth, the growth factors that they contain, also have an immunomodulatory effect on tenocytes and stimulate secretion of angiogenic proteins. So essentially, the PRP or those platelets have kind of concentrated growth factors that get released after we inject them. The issue with PRP is that there are multiple formulations, and we don't know what the ideal formulation is based on the current literature. Supposedly, the ideal product is somewhere between 2 to 6 times the platelet concentration compared to the CBC. And we at least know that we want a low red blood cell count, especially if you're injecting it into a joint. The red blood cells can have a detrimental effect on the cartilage. If we're injecting it into a soft tissue like a tendon or ligament, we don't really know. And then there's a big debate on the leukocyte level. And so depending on which system you have, you can really kind of tinker with having a high leukocyte or low leukocyte level. And we really don't know what is best. There's kind of a thought, maybe at least kind of this is hypothesized, that for soft tissue injuries, especially kind of chronic injuries, like those chronic supraspinatus injuries, that maybe we want a higher leukocyte level to stimulate inflammation to then stimulate healing, as opposed to putting it into a joint where we don't want to cause inflammation. So maybe having a low leukocyte level for joint injections, a higher leukocyte level for soft tissue, but that is just a hypothesis. We don't actually have anything to evaluate that. And then the other thing to know is that there are multiple commercial systems that produce PRP. You don't just do it in just a regular like centrifuge and spin down the platelets and pull it off with a pipette. There are commercial systems that have special centrifugation systems to concentrate that PRP. But there is a significant variation between the commercial systems. And so there have been a couple of studies that have kind of looked at side-by-side comparisons between these systems, and there's significant variation in the number of platelets, the number of white blood cells, growth factors, etc. So they're not all made equal. And then some systems are validated and some are not. So if you don't have a PRP system in your practice and it's something that you want to add, definitely do your research on the different systems and what the validation is, what kind of products they produce, how much control you have over the products. Some can set them to their high dome. Some are more customizable than others. What do we expect with PRP injections? So when we're doing injections of PRP, we typically let the owners know that the dog may have a mild increase in discomfort for 24 to 72 hours after the injection. So we recommend rest. There's a little bit of debate about whether using NSAIDs concurrently is contraindicated. In humans, they typically discontinue NSAIDs for a week or two prior to PRP and a week or two after. But also most human NSAIDs are just COX-1 or are not COX specific. So they affect COX-1 and potentially platelets, whereas most of our veterinary NSAIDs are COX-2 specific, so may not have as much of an effect on the platelets and the platelet-rich plasma as on the human side. That also still is kind of up in the air. Typically, my protocol for PRP treatments for soft tissue injuries are 1 to 3 injections, depending on the severity of injury and the chronicity. Most of the time I'm doing 2, I would say on average, 1 to 2. I'd say it's less often that I do 3. And I'm typically doing them about 30 days apart. So a couple of studies that looked at some regenerative medicine with treatment of tendon and ligament injuries. This combined stem cells and PRP for supraspinatus tendinopathy. And in 55 dogs, they had improvement in gait analysis, improvement in the ultrasound findings. But, this is a little bit complicated because it's a combination product. So how much of the effect was the stem cells? How much of the effect was the PRP? Or was it actually the combination of the two that had a synergistic response? And it was actually that specific combination that caused the improvement. So some of the combo products make the studies a little bit complicated. And this one looked at, once again, combination of bone marrow aspirate and PRP for supraspinatus tendinopathies and similar kind of results. So improved ultrasound findings and improvement in size and fiber pattern and echogenicity. So kind of what those those ultrasound findings that we're looking for to identify healing. And this is an interesting in vitro study looking at equine PRP. They looked at the effect of shockwave therapy on PRP, and they found that there was an increase in growth factor release in vitro. And so based on this, and we don't have any in vivo studies, we don't have any canine studies, but based on this, most of the time what I'm doing is I am injecting PRP and then following it up with Shockwave. Manual therapy, soft tissue mobilization and massage, passive range of motion and stretching and joint mobilizations, depending on exactly like what we are treating, what joint, what tissue. This is often part of my therapy. The other nice thing about at least the massage and passive range of motion stretching is these are things that we can also give the owners. Mobilizations are a little bit more kind of specific to, our treatment modalities, but the owners often feel, more involved if we're giving them kind of some manual therapy stuff to do at home. And we know, at least based on kind of this one study, that acupuncture and manual therapy did improve canine musculoskeletal pain. This obviously wasn't specific for soft tissue injuries or improved healing or anything like that, but improved comfort. And then same sort of thing, effective massage therapy on pain and quality of life. So improving, comfort is obviously one of our primary goals, even though, our ultimate goal is getting them back to sport and whatever level of sport that they were competing at prior to their injury. Pulse electromagnetic field therapy has this kind of cascade of effects. So it enhances the binding of calcium to calmodulin, and then that has an effect on nitric oxide and kind of this whole downstream cascade of effects that increases production of VEGF and fibroblast growth factor. And there are actually a couple of really nice prospective double-blinded placebo-controlled trials for pulsed electromagnetic field therapy. The caveat to this is they were both for kind of post-hemilaminectomy, so neurologic dogs. But they were very nicely done studies. They did show that wound healing was improved, the pain control was better. For this one, the dogs had kind of improved kind of neurologic indicators, so the GFAP concentrations and their proprioceptive placing was better. So we know it has effects on neurologic function, but it also has effects on pain. And so I do use it in the soft tissue injuries for, the sporting dogs. Even though we don't actually have the evidence to say it improves healing for soft tissue injuries, it likely helps with pain. And once again, like it's a home-based modality and gives the owners something to do, with the dog at home, especially, if we're only seeing the dog a couple of times a week for, in hospital rehab therapy, then they're getting some consistent kind of modality treatments at home. Other modalities, we can use heat therapy and cryotherapy, kind of each have its own place depending on exactly what we're treating. Typically, we're not, trying to improve healing of the soft tissues. This is more usually kind of in the acute injury setting to, help reduce swelling, improve blood flow, that type of thing. But some dogs, especially if they've had, if it's a chronic soft tissue injury and they have, muscle shortening, they've got a lot of tightness, they've got myofascial tension, using kind of the thermal therapies can be kind of helpful as an adjunct. I don't use them alone, but as an adjunct. And once again, these are things that the owners can do at home. Therapeutic exercises, if anybody has been to human PT, exercise therapy is really the primary kind of treatment modality for most injuries, kind of on the human side. They do use some of the other modalities. They do use Shockwave. Lasers less often because it's not covered by insurance. They do a lot of injection therapies. But really kind of the core of rehab and PT for human soft tissue injuries is exercise. And the reason for that is we want to increase muscle strength. So a lot of times they've lost muscle mass and strength because of the injury, but also we want to improve their strength and stability to potentially reduce the risk of re-injury. And we know, at least kind of on the human side, there's a huge body of literature on kind of exercise and strength and muscular balance and imbalances and neuromuscular control on the human side. And so we know that those muscular imbalances can significantly increase the risk of injury. So we need to retrain that muscle balance in dogs. We don't think about it as often. Also, neuromuscular control, especially for our sporting dogs that require so much, speed and coordination. That neuromuscular control is critical. So improving that neuromuscular control, either that they've lost because of their injury, or even the dogs that may not have great neuromuscular control just to begin with, that puts them at a higher risk of injury. So we want to make sure we're improving that. Also improving endurance, depending on the sport. I mean, some sports are sprint sports, so endurance is less important. But endurance for that specific sport is important to retrain. And then obviously our ultimate goal, besides getting them back to sport, is trying to prevent that re-injury. So exercise progression, typically we're starting with isometric exercises. So that's where the body's kind of held in space. There's no flexion and extension of the joints. So basically like us holding a plank. And then looking at going to open chain eccentric exercises. So those are exercises where the muscle is lengthening as it's contracting, but there's no weight put through the paw. So that would be something like a high five. And then closed chain concentric is a muscle shortening as it's contracting, and there's some weight through that limb. And then closed chain eccentric, that's going to be your hardest type of muscle contraction. And that's where that muscle is lengthening as it's under stress, and there's weight through that. And so the eccentric muscle contractions are typically the contractions that result in injury. So kind of that muscle is being forced to work as it's being stretched and is under stress. So dogs that are, decelerating significantly and really stretching that bicep while it's being loaded. Those types of, activities are typically what result in kind of tendinopathies. And so it's really important that we don't miss that kind of strengthening component to kind of strengthen those eccentric muscle contractions, especially under load. That really is one of those things that is needed to kind of prevent injury. And so once again, kind of some examples of isometric and open chain eccentric exercises. So posture work is basically like us just kind of doing planks, weight shifting, three-legged stands. So anything where the dog's not, really flexing and extending joints. Open chain eccentric is kind of like that high five, or rear foot targeting, where you ask them to like lift their back foot and target something, but they're not actually touching anything. And then, there's a whole slew of exercises for closed chain, concentric, and eccentric. The other thing to note too is that, obviously for us, we can target specific muscles with exercises. So you can go to the gym, you've got these exercise machines, you can do bicep curls that very specifically target the bicep. We can't do that in our dogs. And so really what we're doing is manipulating their body weight to change the load distribution. And so if we want to decrease the load on the front end, so make it easier, we raise the front end up. Opposite, if we want to increase the load on the front end. So if it's a shoulder injury and they're well healed and we're really working on strengthening, then we can raise the rear end up and shift that weight forward to the front end. And then we can make the exercises dynamic. And I think that this is, something to keep in mind, and adding in unstable surfaces. And so I think this is important to note with our sporting dogs is that people, especially the sporting dog owners, they have this idea in their head that their dogs are super strong, they're super coordinated, they can do all these really challenging exercises. And a lot of times they're skipping the basics. And so they want their dogs doing all this stuff on these balance balls and, peanuts and all of this stuff. And really, their dogs are not strong enough to be able to do those exercises. And this goes for normal, non-injured dogs as well, is that people significantly overestimate their dog's ability to do a lot of these exercises. And they want to do complex exercises and really encouraging owners to take a step back and really focus on foundation exercises, the static exercises that look really easy, especially for these like high level sporting dogs, but actually take a lot more strength and coordination than I think that the owners typically realize. And making sure we have a really strong foundation before making exercises dynamic, before adding in unstable surfaces. Because if we skip that step, that kind of neuromuscular control, we don't have as much neuromuscular control as we need to. And so I think that sometimes that gap in that foundation could potentially, increase the risk of injury. People think that they're doing all these exercises to strengthen their dog, but they're really missing kind of key factors in that neuromuscular control. And then once we kind of get this dynamic and unstable, then add in those plyometric exercises. So, kind of those jump exercises. And then we have to even go beyond there. So a lot of times for pet dogs, the dynamic and unstable surfaces and some of the plyometric is where I stop. But if we're talking about strengthening our sport dog population, we have to have specific sport retraining exercises. And that's going to look different, but depending on the sport. So your, agility dog, retraining exercises are going to be different than your flyball retraining exercises that are going to be different than your protection sport retraining exercises. And so we need to really make sure that we're really kind of focusing on the specificity of our exercises for our sporting dogs. So I'm going to kind of jump into some protocols for specific conditions. And, this is just kind of some of the most common conditions I see. And so general recommendations, regardless of what, soft tissue injury we're talking about, exercise restriction, but this is not strict cage rest. I'm not a big proponent of strict cage rest. I don't want them to lose muscle as much as possible, especially if we're talking about having to get them back to sport. We want to really keep as much muscle mass, keep as much mobility as we can during the recovery period. This is mainly just no running, no jumping, no roughhousing, so no high impact activity. Pharmaceutical therapy as indicated, depending on how painful they are. All dogs get a home exercise plan. And then in general, they're getting kind of formal in-clinic rehab 1 to 2 times a week. And then musculoskeletal ultrasound I use for diagnosis for basically all of my patients. And then I'm rechecking that ultrasound usually about 8 to 12 weeks to evaluate the degree of healing. Timeline is heavily dependent on the grade of injury and concurrent pathology. So if they just have a bicep tendinopathy and no concurrent pathology, that's going to be very different than a dog who has a shoulder tendinopathy and also has mild elbow dysplasia. Or a dog that has iliopsoas pain and has lumbosacral disease. So concurrent pathology plays a big role in time frame. But in general, I'm, setting the clients up for 8 to 16 weeks of rehab, 8 to 12 weeks of strength and conditioning for sport, and then even 12 to 16 weeks of sport-specific retraining. Now that's kind of on the longer end, but I would rather have the clients have an expectation that this is going to be a long, haul, and then have it go faster than be like, oh yeah, you can do that national competition in 8 weeks. And then we recheck the ultrasound and we're like, just kidding. Like that's not going to happen. And then set them up for kind of disappointment. So for bicep and supraspinatus tendinopathies, these are the most common injuries that we see in agility and flyball dogs. Typically, I'm using Shockwave Therapy, either the 5 or 20 millimeter trode, depending on the patient's size. Usually around Energy E5. For this, so this is for an electrohydraulic, the PulseVet unit. Energy E5, they have the settings, 360 pulses per minute. And then depending on whether it's just one, bicep or supraspinatus, I'm typically doing 1,000 pulses. If it's both together, then I'm doing 1,500. And then typically 3 treatments, 3 to 4 weeks apart. I'm usually adding in laser therapy and then therapeutic exercises. And then at the 8-week recheck, I'm saying, is it better? Is it the same? Or is it worse? And then that's kind of where we get into this next category. So if it's moderate to severe to start out with, the pathology in the tendon, or if they've had a mild one, mild tendinopathy, and at that 8-week recheck, we haven't made any difference, then I'm doing kind of the regenerative medicine. So doing PRP, ultrasound guided into the supraspinatus, and then sometimes ultrasound guided into the bicep or into the joint if there's not a core lesion. And then about 2 treatments about 4 weeks apart. The shockwave therapy protocol for the moderate to severe cases is about the same essentially, but I do it after PRP. So I'll inject them first and then do the shockwave. And then for these cases, I'm basically always doing laser therapy with that 20 joules per centimeter squared and 2 to 3 times a week protocol. Then all dogs are getting therapeutic exercises and then they're getting repeat ultrasounds. And then clearly, if you fail conservative management, if they have a partial tear that, worsens, you can do surgery and do a bicep release, but that's a little, out of that. I usually hopefully get them fixed before they actually need surgery. I'd say only a small number end up progressing to the need to have a bicep release. Iliopsoas tendinopathy, once again, this could be a whole thing in and of itself. The biggest thing to note if you have iliopsoas pain is look for a concurrent pathology. Almost all iliopsoas tendinopathies are secondary to something else. That iliopsoas is compensating for instability somewhere else. So lumbosacral disease is probably the most common one that we see, hip dysplasia, and then stifle pathology, usually like a cruciate. And so I think that the reason that iliopsoas gets a bad rap as being a really hard thing to treat and a really recurrent injury is that we're missing treating the underlying pathology. So if we're just treating the iliopsoas and nothing else, then yeah, it's probably going to recur as soon as the dog goes back to activity. So making sure we're identifying and treating any concurrent pathology is really key to iliopsoas. And I'm happy to talk about that further, but we just don't have time in this specific talk. But treatment for mild cases of iliopsoas tendinopathy, and we're talking about just treating the iliopsoas. So I'm not going to get into treating the concurrent pathology. So if the dog has LS disease and then has a secondary iliopsoas tendinopathy, I'm also treating the LS disease. This is just the protocol for the iliopsoas itself. Or if it's a primary iliopsoas injury from a slip or a fall, also my treatment. So if it's mild, so like grade 1, I'm doing shockwave, same type of protocol, 5 or 20 millimeter trode, depending on the size. E5, 1,000 pulses, 3 treatments, 3 to 4 weeks apart. Laser therapy, a lot of times these dogs can be pretty painful, and a lot of times they'll have back pain. Now, the question is whether they have underlying LS disease that's causing the back pain and we're just not identifying it. But I'm typically also doing TENS kind of at that L1 to L2. That helps with their pain control. Once again, always doing therapeutic exercises and then repeating ultrasound around 8 weeks. So better, same, worse. And then kind of moderate to severe, we'll do ultrasound guided injections of PRP, usually 2 treatments about 4 weeks apart. So same kind of treatment, regimen as that Shockwave. So do, the PRP injection, Shockwave, 4 weeks later, PRP injection, Shockwave. And same Shockwave protocol, regardless of whether it's kind of a mild or severe case. Carpal ligament and tendon injuries, same sort of thing. PRP, ultrasound guided, and then Shockwave. Typically not as many pulses for carpal injuries because it's a much smaller area. So what about underwater treadmill? I haven't talked about that at all. I typically say it's contraindicated for initial stages of rehab for iliopsoas and shoulder tendinopathies. And if you think about the biomechanics of those specific muscles, that bicep tendon has to work against the resistance of the water. Same as the iliopsoas tendon, that has to work against the resistance of the water. So if you're using it in the acute stage, a lot of times you can make the lameness worse. And so typically I wait about 8 weeks to start underwater treadmill for these soft tissue, for the shoulder and iliopsoas tendinopathies. I will start earlier for carpal ligament and tendon injuries because the biomechanics are different. So they're not having to work as hard against the water. It's decreasing weight bearing on the carpus. So I feel a lot more comfortable doing that. And so kind of in conclusion, make sure you understand the tissue healing timelines and set the clients up for expectations based on those healing timelines. We have lots of modalities for treatment, but not a lot of research. My kind of personal top choice, and this is just based on my experience, this is not based on any literature to support it, is I typically use orthobiologics, specifically PRP and shockwave therapy together. That's usually my go-to. And then an exercise plan should always be included. And then one size does not fit all. So make sure you're treating the patient, not just the imaging. And then consider the severity of pathology. And that's why ultrasound is really nice, because we can really get a good visualization of the pathology in the tendon or ligament or muscle. And that really helps us to do kind of these serial ultrasounds to evaluate kind of progression of healing. And then make sure you're considering and identifying any underlying or concurrent pathologies and treating those, and then setting those owner expectations. And then limitations. The one kind of downside, I talk about kind of grading of injuries for ligaments and tendons, is we don't have any standardized grading in tendinopathies for dogs. And then we have very limited research on treatment protocols. Most are retrospective, and the research protocols vary widely. So we're kind of left with that. But hopefully, in the next 3, 5, years, we'll have quite a bit more research. So stay tuned. Hopefully talk, 3 years from now will look a lot different than the talk today.